So Ruth, in this complex world that we live in medical care and rare diseases, give me a sense as a patient, what role and what value do patient organizations serve the patients with these diseases?
Yeah, it's a great question. There's so much information out there that isn't necessarily accurate or up to date. And in my experience, not-for-profit organizations, advocacy organizations do a good job of not just keeping patients up to date on the latest, but also a few things that other organizations wouldn't do. And that is a patient walks away not feeling like they're not alone. There's other people in the same situation as them. Feeling not alone is very important when you're going through something, especially in a rare disease. I think that they're an independent voice, and that's very different than a pharmaceutical company, very different than even your own doctor. They're a third-party, independent, non-judgmental organization that hears from lots of patients, and so they bring that shared experience to the table, and I think that's really important.
And you've been doing this meaning being a patient and a medical writer for many years. Now that we live in this COVID era where a lot of interactions are virtual, do you find that the patient support virtual interactions are helpful?
Oh, I do. Yeah. I know so many people who are involved in very beneficial support networks online, which is different than a Facebook group where it's uncontrolled. I know lots of people who have very strong relationships with people who moderate support groups, and the fact that we can do them online just expands, the ability and the access tremendously, because everybody can't go at 4 o'clock in the afternoon to a support group at their hospital, 150 miles away. So, yeah, I think that's really helpful.